Today's episode of the Counselling Tutor Podcast is sponsored by Web Healer. You're a counsellor in private practice and you need a website, or you've got an existing website which you need help with. Web Healer are offering Counselling Tutor Podcast listeners, that's you, £100 off the cost of a website design and build. Now, Web Healers specialise in websites for counsellors and psychotherapists. It's what they do. And the Web Healer team provide a completely non-technical, done-for-you solution, leaving you to focus your time on your clients. Operating for 20 years, Web Healer are a trusted resource amongst counsellors when it comes to getting your practice online. So get the package details and claim your £100 off coupon for your new website by going to counsellingtutor.com/website. That's counsellingtutor.com/website.
Hi, I'm Rory, and welcome to episode 292 of the Counselling Tutor Podcast. We have a very special guest on today's episode. We're joined by Kate Day. She's a senior accredited fellow of the National Counselling and Psychotherapeutic Society. She has an advanced diploma in counselling, a postgraduate diploma in child and adolescent therapy, postgraduate diploma in group analysis, and an advanced diploma in clinical supervision. Apart from that, Kate is a busy campaigner for the children's mental health. She's been a member of the All-Party Parliamentary Group on a fit and healthy childhood, and she also runs a training company that teaches therapists how to work with clients who are self-harming, a subject she will speak with us about today. So with that said, let's get on with today's episode.
Welcome to the Counselling Tutor Podcast, the must-listen-to podcast for counsellors, psychotherapists, and counselling students. Here are your hosts, Rory Lise Oakes and Ken Kelly.
Very warm welcome from Rory and myself. As Rory said, it's episode 292. 3 stops on today's journey, starting with ethical, sustainable practice, discussing ethical framework in supervision. And then we're going into Practice Matters. That's that interview with Kate Day, working with self-harm, an all-important topic. And then we move on to our student services, where today we're going to be speaking about logging those client hours. And we're going to be sharing with you the do's and the don'ts. But starting us off, Rory, that ethical, sustainable practice, discussing ethical frameworks in supervision.
Yes, Ken. And the reason I brought this is because recently one of my supervisees went for accreditation. She decided that she wanted to become an accredited therapist. And as part of the paperwork, I had to fill in a part as her supervisor. And one of the things that was asked was, is the ethical framework discussed in supervision? Is it a regular topic on the agenda? And I was very pleased to be able to say, with all honesty, yes, it is. Because ethical frameworks are our codes of practice. So there's many different ethical bodies. We've talked about this on the podcast many times. If you're working in the UK, you're under what's called the Professional Standards Authority, which is the top of the pyramid. And underneath the pyramid, or the umbrella, better way of thinking about it is the umbrella. Professional Standards Authority is the umbrella. And underneath that umbrella are a number of professional bodies who hold an accredited register. So they basically work all on the same principle. They have to report and justify themselves to the Professional Standards Authority. And one of the questions is, do you speak about the ethical framework in supervision? And the answer is yes, and it should be spoken about in supervision. It should be a regular agenda, a topic agenda. I'm sure there are a few people who might be listening who may very well, the last time they looked at their professional or ethical frameworks was when they had to do an essay on it in college. And I would say that it's essential for professional therapists now to revisit their ethical framework at every opportunity to make sure that they understand their obligations. We're now a profession. We may not be a very well-paid profession, and maybe that is a discussion for another podcast, but we are a profession, and most people in different professions understand their codes of practice. So supervisors should, I think, always try to discuss at least at some point in supervision, what part of the ethical framework are they working to? And certainly if there's an ethical dilemma that's brought up in supervision, get that ethical framework out, get the codes of practice out, and start to work through that. And hopefully it'll become second nature. It'll be like that kind of self-supervisor we sometimes talk about, where if something comes up in practice, you're automatically kind of scrolling in and tuning into your ethical codes to know exactly what your next move may be in supporting the client. It's a very important part of professional practice, and I fear that sometimes it's one that perhaps isn't paid enough attention to, Ken.
Yeah, and I guess within supervision, the ethical framework will naturally weave its way into supervision. It should anyway. And we've identified 5 areas where your ethical framework is going to weave itself into your supervision practice. And one of those pointers is guidance in complex situations. Counselling can be ambiguous at times. You can be left not really knowing what to do. You can have 2 paths of action. Both of them feel ethical or both of them feel challenging. And it's, what do I do? And going in and speaking with your supervisor and then looking together at the ethical framework and what is suggested around where you find yourself can be very freeing. And of course, if nothing else, it gives you what we call defensible decision making, where when you make a decision, either A or B or C or whatever that may be, you're able to say why you made that. And within your notes, you might mention that you spoke to your supervisor about the ambiguity of the situation you found yourself in, what you discussed with your supervisor, what you referred to in the ethical framework, and why you made the decision that you made. And that is defensible decision making, where you can evidence why you made a certain decision, as opposed to kind of just picking one at random or the one that felt right at the time. So that's guidance in those complex situations, and they certainly come up a lot, Rory.
Yes, they do. I'm never surprised when I supervise at how often part of the supervision discussion will be around ethical frameworks, or what is the ethical thing to do. And sometimes, here's the thing, it's not always about the client. It's not always about the client. Sometimes it can be a professional challenging the organization. I've had a number of occasions recently where a supervisor has said, I'm not so sure that what I'm being asked to do is ethical. They work for an organization. The organization has asked them to do something, and without kind of breaking confidentiality, they've said it doesn't feel right. And I said, well, let's have a look at the ethical framework. I said, because that then gives you, a line of defense and a line of inquiry to be able to say to the people who employ you, look, I've had a look at this and I'm actually compromised by my ethical framework. I'm in a compromised position here. And usually it's a lot of the difficulties that therapists have around their employment is because their employers aren't clear about the ethics that therapists work under. So it can be used to manage up as well as kind of manage situations in the therapy room, Ken.
I certainly can look back on my practice career, Rory, and see a number of times where that has definitely been the case. And I'm going to go on to kind of point 2 now of where the ethical framework might weave its way into supervision. And I guess we're covering these topics to kind of show how the ethical framework might be used in supervision. It's not that you're going to get the ethical framework out and read it together to say and tick a box and say, yes, we've looked at the ethical framework. No. It's going to be linked to you, your practice, and point number 2, your professional development, because regular discussion about the ethical and professional frameworks, they're going to contribute to your ongoing professional development as a counsellor. And the conversations help you stay informed, and they help you stay current with, yes, what the ethical standards are, but also legalities and the requirements that we have as counsellors and psychotherapists. So I'm going to give you an example. You may go into your supervisor and say, you know what, I'm thinking of building myself a website. I think that in my private practice, if I put myself a website out, I might be able to get some additional clients, and I'd like to do that. And that's a topic you might share with your supervisor. Your supervisor then may bring out the ethical framework or refer to the ethical framework and speak about the protection of the client's data, the law, the UK GDPR, General Data Protection Regulation. If you're based in the United Kingdom, if you're if you're in the EU, it is just GDPR. And if you're elsewhere in the world, of course, look and see what are the laws that govern protection of data, how it is taken, stored and used and recalled where you stay. But there's an example where professional development, your development, would be informed by the ethical framework, and it would weave its way into the supervisionary sessions.
Yeah, absolutely. And data protection is becoming a bigger and bigger part of our practices now. We discussed it on episode 291 regarding, the use of AI and transcripts for students. And, we've spoken about this on a number of occasions about making sure our clients' data is safe and where we save it. That is going to be a big part of working ethically. And also, I think that, prevention, as they say, is better than cure, Ken. And, if you can prevent an ethical dilemma and head it off at the pass before it becomes far bigger than you can manage and may lead to a complaint, you're going to be on the right side of things. And one of the things that comes up in my practice, on a regular basis, and my supervision practice is dual relationships where people are asked to counsel maybe members of staff at an organization or people they may know, and how that is managed. And it's really important to be able to defend yourself, to have a defensible decision that you make as a practitioner should you be called to account. If you're brought in front of a professional ethics committee and they ask you a question, one of the things that they're going to ask you is, what part of the ethical framework did you consult before making the decisions you made? Mm-hmm. And if you said, well, I didn't, I've not looked at it since I was a student, you're going to find yourself, I would say, in some difficulty. And, if you have looked at the ethical framework, you can mitigate any difficulties by saying, I've looked at it, this is what I considered, this is what I discussed in supervision, this is what I put in place. And all these will mitigate a difficulty you might have. So prevention is better than cure, and having a proactive approach, going out thinking ethically will always, I think, put you on the right side of things. You're less likely to get into difficulty if you have an ethical mindset built in and embedded into your practice.
That brings us so nicely onto the next point, Rory, which is that fostering of a culture of ethical practice by regularly consulting the framework, discussing the framework, bringing it into your supervision sessions, whether it be by your introduction or your supervisor bringing that in. You're re-looking at it and revisiting it time and time again, and which is perfect for, as you've just said, Rory, preventing ethical violations. If we've got a good understanding of the framework to which we use, we may see those red flags before they arrive, and that is because we would have fostered that culture of ethical practice. And why? Well, it's going to raise the standard of counselling in general. It's better service to the clients. And if we look to why the ethical frameworks were put in place in the first place, it is to protect us in our practice. It is to protect the clients, but it is also a reflection of what is considered best practice at the time. And that is why we see the ethical frameworks will change over time when there is a change in legislation, when new technology comes in. So, we've spoken, Rory, I don't think it's a secret that our feeling, we're pretty bullish that there will be a change in ethical frameworks coming shortly. Why? Because there's been a massive movement in the world towards AI, which is going to affect every single aspect of how we interact online. So chances are that's going to find its way into the ethical framework. So it keeps us current with what is happening, and just having that culture of ethical practice, regularly looking at the framework, keeping it top of mind, is in best service of ourselves, protection of our practice, and of course the clients that we see, Rory.
Absolutely. And it also fosters trust in the profession.
Oh, yes.
That is such an important thing. You know, when people come to therapy, some will come to therapy because they may have had a colleague or a friend or a family member who's been to therapy and said, you know, it was so helpful to me. It was just so wonderful. And it fosters trust in the profession, because to a majority of the general public, what we do is kind of unseen. It's a bit of a hidden piece of work, really, because it takes place in a confidential environment. So if we can foster an environment where those who've had therapy can say to others, it was a really positive experience. I made the changes in my life. I felt really supported by my therapist. Then what will happen is that someone else who needs therapy may go and access it. But the contrary can happen if someone is working with an unethical therapist, or someone who it misunderstands or doesn't understand codes of practices within our profession. And that can lead to conversations from members of the general public saying, well, I won't want to go to a counsellor. They've done this, they've done that. I had to make a complaint.
Yeah.
And, you know, bad news spreads fast. And, you know, when it comes to mental health, it's important. It's important that people get the service and the care and the professionalism that they deserve. These people who go to therapy are people who might have a variety of challenges, a variety of difficulties, and the general public deserve to have our best selves sat in front of them, and that includes being ethical.
100%, Rory, and just kind of underlines the fifth point we wanted to cover today, and that's supporting client welfare. It is in service of the clients. You know, everything we've discussed so far, the only reason we would look to that framework is so that we can better serve, and we revisit regularly, foster that ethical culture of ethical practice. We can prevent potential instances before they come, because we're aware of the ethical framework. We might see signs, helps us with our professional development, and of course guides us in those complex situations. And there is a super duper handout for this that Rory has created that covers these points, and it kind of goes a little bit more in depth than we have here. So you can get that by going to counsellingtutor.com. That's our website. Click on the podcast tab, make your way to episode 292. That's today's episode, and you can download that document there. And I guess if anything, I consider, when last did the ethical framework appear in your supervision session? And it's the thing is, we might say, oh well, my supervisor hasn't brought it in for a while. Well, it's your supervision. Perhaps the challenge here is that you might go in and say, you know, I wonder if we might discuss such and such and relate that to the ethical framework. And I would be surprised, Rory, I would be surprised if any counsellor could bring anything into supervision in a 1.5 hour supervision session that wouldn't link strongly to an ethical framework. It is always there. Pretty much when we're presenting, if I go into my supervisor and say, oh, I might do some CPD on that topic, well, that's mentioned in the ethical framework. How many hours CPD have you done so far? It all kind of ties in at the end of the day. It's almost the tie that binds. The ethical framework holds everything together. You've mentioned before, Rory, it's like a kid's climbing frame where you've got the metal bars, and when you're on the inside, you're protected by that. You're inside the framework, and we practice within that framework, and our supervision sits within that framework. It just does. So if you haven't seen the ethical framework for some time, go to your ethical body, download it, have a read over it, take it into supervision, and kick off that discussion.
Yeah, absolutely. And I'll pick up on the point about, you know, taking responsibility in practice. You know, if your supervisor isn't bringing it up, you know, go to your supervisor, because it is consultative work. Supervision is two professionals meeting for the benefit of one's clients. In other words, the supervisee's clients. Why don't you print the ethical framework out, or put it on your device so it can be easily read, the current framework, and and have a discussion about how you're working within that. Have a look at the framework and say, I'm bringing this issue to supervision, and I'd like to know how it impacts on the framework, and view the supervisory movement and what you get from supervision through the optic of your professional framework. You might find you get a completely different perspective and maybe a different way of working in service of the clients.
Yeah. If you're listening to this and you considering yourself a seasoned practitioner, mature in your practice, and you think, you know what, I think I'd like to be a supervisor, and you're interested in looking at what that would entail, Counselling Tutor offer clinical supervision training. And if you want to find out more about that, just go to counsellingtutor.com. Right there on the homepage, you will find all of the information. You can go and look in depth at what the course entails. And there is some areas on that page there that will help you understand whether you are ready to become a supervisor. And that you'll find counsellingtutor.com. And that is today's ethical sustainable practice. And as we kind of back out of ethical sustainable practice, that ESP, as we call it, better than mind reading, isn't it? Ethical sustainable practice. We're going to Practice Matters, and that is the CPD section of the Counselling Tutor podcast. Look to your ethical framework. It's going to require you to do a certain amount of CPD hours. Well, you can put down listening to this podcast into that as well, onto your hours tracker. Today, an important topic. It's a topic that when it presents in your counselling room is ultra serious. And Rory, you and I often say the client can only go as far as the counsellor goes. As soon as the client comes in with something that we don't fully understand, we're not able to go there with them. And something that will present so often is self-harm. And you met up with Kate Day on working with self-harm, Rory. Absolutely.
As you say, it's a subject sometimes which some therapists find a little bit scary and may be reluctant to work with. I was so pleased to interview Kate Day, an absolute expert in this field. She trains therapists around working with self-harm and suicidal ideation. And I spoke to her about this very topic, and this is what she had to say.
Practice Matters is proudly sponsored by the Counsellor CPD Library. To access top quality, relevant continuing professional development for your practice that you can do at a time that suits you, and all for less than the price of a cup of coffee, visit counsellingtutor.com.
One of the recurring themes that comes up in anybody's psychotherapeutic practice is the theme of self-harm. How do we work with it, and how do we manage it, especially if we're working with young people? So I'm delighted today to have a really special guest on the podcast, Kate Day from KRD Training, who specialises in self-harm and risk assessment and is a child therapist. And she's going to answer some questions around self-harm and how it's managed. So Kate Day, thank you so much for joining us.
Well, thank you so much for inviting me today, Rory.
So I guess the first question, and it's quite an obvious one really, isn't it? Why do people self-harm?
Well, people self-harm for many different reasons. Some people self-harm as a way of self-punishment in response to self-loathing or anger to themselves. Others harm to gain a sense of control or self-regulation, whatever might feel difficult or uncomfortable feelings, thoughts, or a situation they might be in. But often people harm to express their distress, stabilise mood, disassociate, or relieve unbearable tension. Now, we know that neurodiverse people are particularly vulnerable here, Rory, as we know by research that ADHD and autism is associated with increased risk of self-harm, especially in young people, and also suicide in young people and adults. However, the nature and the meaning of self-harm varies greatly from person to person, and so does the reason to why a person is self-harming. And I think it's really good for us as therapists to remember that when we're working with self-harm, that a reason a person harms themselves may be different on each occasion. And, we shouldn't presume it to always be the same. And I always encourage therapists when I'm training them in self-harm to consider with their client what's going on underneath the behaviour. what is driving the harm?
Yes, I think those are very, very distinct observations, and I think that anybody listening should be taking that away and having a think about that. Some very interesting questions to ask self. Do people who self-harm suicidal? What is the situation there?
That's a good question, and it's an important question, because sometimes people self-harm with an intention to die, and some people self-harm to avert suicide. And it can become a way of surviving. However, we can't ignore the fact that over half of people that die from suicide have a history of self-harm. And this is why early intervention is so important. In my experience with clients that self-harm, often the intention is not to actually end their life, but rather wanting the problem or the pain to go away.
Absolutely. And I guess that leads me on to my second question. In what ways do people self-harm? How do people self-harm?
Well, they harm. There's many ways that people self-harm, and to varying levels and different degrees. Acts of self-harm might include something like cutting, pulling out hair, excessive biting, picking or burning of skin, to self-poisoning and eating issues. But there are also the more unknown forms of self-harm, which are often psychologically based. And it's like a kind of form of self-sabotage, like a client repeating harmful patterns and practices that are kind of stress-inducing in their work or school life.
Can you give us an example of that? What kind of things may show us this kind of psychological self-harming?
Well, I suppose we're thinking for like maybe someone that's a perfectionist, a workaholic, or a high achiever, to a person that initiates a fight on a night out in order to be hurt. All of these often result in a high cost to one's physical and mental well-being. I think perhaps one of the most concerning at the moment is that there's been an increase in suicide in the UK due to more lethal methods being used, such as hanging, suffocation, and poisoning methods. And people can kind of gain this information all too easily offline. And children and young people are especially vulnerable to this. They're vulnerable to exploitation, and the ease of them being able to access illegal drugs and prescriptive drugs and poisons, which may result in an accidental death because they don't fully understand its lethality.
Yes, I can see that some people may self-harm, but that could lead to them effectively taking their own lives. So I guess what's helpful when working in practice with people who self-harm, what kind of help or helpful interventions could therapists use?
I think firstly and most importantly, it's coming back to the base of what we do, allowing the client the space and time to talk about their self-harm with a skilled and empathic practitioner. I think second aligned to this is to remain non-judgmental, because this can further shame or isolate your client. And there is a lot of shame around associated to self-harm. So the therapist's self-awareness here is really crucial. And it's good always to distinguish between the person and the behaviour. Because often as therapists, we may be alarmed by self-harm, and we might unconsciously project these feelings and thoughts onto the client and try to kind of fix them and fix the harm.
Yeah, what happens if therapists try and fix clients in terms of self-harm?
Well, when we try to fix our client, we are ultimately disempowering them, because the power to facilitate any really long-term change rests within the client themselves, and their own resources. And that doesn't discount our desire to, be supportive in the therapeutic relationship to facilitate this change, by kind of instilling hope with our client, suggesting alternative methods to kind of minimizing the harm and ultimately keeping our clients safe. But for me, in my practice, I like to work with clients that self-harm in a collaborative way, rather than using just generic tools. Kind of asking them what could help their self-harm and support the person to practice coping strategies. And it's seeing if it really works for them as an individual. For me, identifying the client's own strengths and protective factors is as important as you're also balancing at the same time their vulnerability and risk.
So definitely helping people become more, be able to empower themselves as opposed to go out and fixing them, so to speak.
Yeah. And sometimes there's these really generic distraction methods, and they can be effective, but we need to find out the client, what works for them.
Yes.
Is this work in practice? Yeah.
Yes, because I know in the past I've used elastic bands. Clients have used elastic bands, or they've even used a red pen to simulate cutting. So those sometimes can be two little methods that me and my clients worked out that were quite helpful in the past.
Yes, really, yeah, really, and again, it's finding what works for you, and and again, there are so many distraction techniques and methods, but I think predominantly we need to find out what the feelings are underneath before we employ a distraction technique.
Yeah, so we need to get to the underlying feelings before we work with a distraction technique. So, if a client discloses self-harm, do we need to dive straight in and find out what's causing it straight away?
Well, when I'm training people in self-harm, I suggest trying, when they disclose, to remain in the here and now, following any disclosures around self-harm. For example, yes, it's important to check for any immediate ongoing risk to themselves or others, and also maybe to think about exploring historic issues that might be triggering the self-harm. But really allowing space in the session to just listen, lean into your client's language and the non-verbal cues, because this deepens the understanding to why this person may be harming. And if we go in too fast, or go in like a bull in a china shop, identifying triggers, trying to fix the harm, this may increase the person's distress even further. So I guess what I'm saying is that clients primarily need reassurance that their thoughts and feelings and anxieties are going to be taken seriously and that we're listening to them. And this is especially vital for those clients who repeat self-harm, who've experienced adverse childhood events such as abuse or neglect or violence. Because in the therapeutic space, alongside a sensitive approach, we can engender a sense of autonomy for those clients that have a history of trauma, as it can create this safe environment for their voice to be heard. And maybe that is for the very first time in their lives.
Yeah, I just paused there because I thought that was I thought that was very, very powerful, in that, sometimes when clients come to us, it's the first time they're actually heard, and someone is sitting there listening without judgment, and they're just able to be themselves. And I think that can be incredibly facilitating just on its own. Now, if we're working with children or young people with self-harm, what are the issues around confidentiality?
And they are different, and it's a good question because they are different from working with adults, and we really need to know the different competencies between working with them. So when we're considering a child or young person, the guiding principle is their safety and well-being. It's good practice to work systemically when working with children and young people, especially when the child is at risk of harm. So if you need to break confidentiality and share information with a parent or guardian or others, I would firstly seek or try to gain consent from the child or young person. It's good to be sort of open and honest from the onset of counselling about where information may be shared. And then go on to also, when you do need to share information, explain to the young person why, what, how, and with whom, and kind of give them choices and options about how they'd like that information to be shared.
Yes. Yeah, I think facilitated choice and it coming from the young person themselves is always better than kind of, dictating. But is there a time when you would not share information with a parent and guardian? So is there a time when you would decide not to share information?
Yes. As a therapist, we need to be aware of the child's situation. So, for example, if self-harm was a result of a situation in their home life and there is a safeguarding reason not to share the information with the parent or guardian, because this could further place them at risk, you may then need to inform the appropriate safeguarding services or CAMS, whilst encouraging them also to talk with another trusted adult to further their safety and support. I think if you're working as a counsellor in a school or any organisation, it's really important that you fully understand the workplace safeguarding policies. And in all cases, I always stress to everybody, when a child or young person is at imminent or serious risk of self-harm or suicidal and they disclose this in the session, immediate disclosure needs to be made to the appropriate emergency services. So we know that, that is got to be a kind of golden rule that when a young person at serious risk of harm, that is always reportable in that instant.
Yes, and certainly with things like poisons or taking medication or pills, that type of thing, it's not unknown for a client to disclose this in the set that they've just taken stuff in the therapy room, in which case then that's definitely a treble 9 call.
And time is important, in terms of their recovery as well. Yeah.
Absolutely. What are your thoughts about risk assessment, doing risk assessment screening?
Risk assessments with the aim of identifying and minimising the risk of self-harm and suicide are a good idea, and they need to be done. However, when I'm sort of training practitioners in self-harm and suicide, I always emphasise the validity of using a risk assessment. Using a risk assessment when, firstly, it's carried out in an empathic and holistic way. Second, that the information that the client gives you is actually supported and actioned into practice, doesn't stay just, on a form, and it's part of the ongoing process. And then lastly, I think any good risk assessment should be comprehensive in evaluating the person's individual needs, their safety considerations, and any other vulnerable factors that can explain why the person is self-harming or at risk.
Yes. I mean, those are really pertinent, should I say, points. A comprehensive risk assessment looks at, as you say, safety needs, considerations, and other factors. I'm aware that we've got some new NICE guidelines. Now, for those of you who aren't listening in the UK, or maybe you are listening in the UK and you're not sure what NICE guidelines are, NICE is an acronym, I think, for the National Institute of Clinical Excellence. And they're an organisation that sets standards for treatment, certainly within the National Health Service. So if you're taking medication, almost certainly they will have been assessed by the National Institute of Clinical Excellence for, the quality of treatment and also any side effects. But when we're talking about risk assessment, the National Institute of Clinical Excellence has actually issued some new guidance, haven't they?
Yes. And, it's important that we look at those guidelines and see how that's relative to the work that we're doing. The suicide and self-harm risk assessments, the guidance by NICE has changed last year. So the guidance said we should not stratify suicide, self-harm risk as low, medium or high, or rely on risk assessment tools to determine who should be treated or use them to predict future suicide or repetition of self-harm treatment. So it should be a more holistic approach. And I really very much welcome this guideline in the healthcare provision particularly, as many of the children and young people that I hear about in my counselling teams that have seen, I have seen an increase in children and young people being released all too soon from an A&E department and not given the appropriate support, as tiered as low risk. And one of the issues here is that sometimes children and young people then feel that their feelings are not being taken seriously, and then they may escalate in terms of their self-harm in order to be seen, and so that's why I'm so welcoming of this new guideline. And I suppose what I'm saying here is that sometimes the wound has not necessarily got, the wound that somebody might have or the harm might have doesn't necessarily show the severity of how the person's feeling distressed inside. And so in that sense, it can't be tiered. We need to look at it in a more holistic way. And I've been working with the National Counselling and Psychotherapy Society to consider how are these new guidelines related to counsellors, especially if you're in private practice. So in conclusion, I think counsellors already take a holistic approach. As what we do is we are continually assessing the child and young person for risk as it's part of the ongoing therapeutic relationship.
Yes.
And it's as simple as we know that child, we're starting to get a gauge of what's going on in their life. And therefore, it's not like they're going to A&E or they're going to the doctor for the first time and that person doesn't know them. So I think that we need to use these guidelines in terms of thinking about how we continue to practice in counselling in such a reparative and holistic way.
Yeah, I mean, I totally agree, and I think that the change in the guidelines is very, very welcome for the reasons you've outlined, and that is that some people may feel they're not being taken seriously if it's a low risk. In other words, you're just attention seeking, that kind of thing, where risk is risk, and if you're unsure where the new guidelines are for National Institute of Clinical Excellence, I think if you just put them into your search engine, you'll find them, and it's well worth having a look. I think this has been a very, very insightful time spent. I've certainly learned a lot, and I'm sure that those who listen will take away incredible value of how to look at risk and just the overall picture of self-harm, be it in adults or children and young people. So it just finally gives me great pleasure to say, Kate Day from KRD Training, thank you so much for joining us.
Massive thank you to Kate Day. Massive thank you to you, Rory, for reaching out, holding these important discussions, these topics, and bringing them to us. And that is a really serious topic, that working with self-harm. And as we kind of go out of Practice Matters, we recognize you, our student. You are formally training to be a counsellor or a psychotherapist. You're on your journey. There's so much new learning. There's so much to consider. And one of the things that can trip up a student right at the end is when you do your placement. You do your placement and you have to log your hours and you hand those hours in your final portfolio, and then suddenly you get it back saying that it doesn't meet the criteria, you've missed something off, you haven't done it correctly. So what we want to do is we want to speak about logging those client hours, the do's and don'ts. Now, if you're already in placement, this is going to be absolute gold for you. If you're not yet in placement, listen to this, flag and bookmark this podcast, because you're gonna want to come back to it. Student Services is sponsored by Counselling Skills Academy. Have you ever wondered if you're using counselling skills effectively? Confidentiality means we rarely see skills used by others, so it's no wonder that so many students say they lack confidence in their counselling skills. That's why I built Counselling Skills Academy. Counselling Skills Academy is an online course that you can do at your own pace. It will give you the skills competence and confidence to know that you're using your skills most effectively. You will see real counselling skills used by a counsellor in real life sessions, covering everything from how risk is assessed right through to working towards an appropriate ending. Visit counselingskillsacademy.com to learn more and to claim your Counselling Tutor discount. That's counselingskillsacademy.com. How many referrals have you seen, Rory, from students who've handed in client logging hours that have been refused by the external moderators?
Quite a few.
Yeah, too many.
Too many. Even though when we talk, Ken, we would share this information. So what I would say is, if you're a student, share this amongst your peers.
Yeah.
If you're logging, share it amongst your peers. And if you are a tutor that's listening to it, we have a lot of colleagues who are tutors, and welcome to you. Why don't you put this podcast on your virtual learning environment and point the students to it? It's going to save you a lot of headaches. So in the UK, courses that allow you to join an ethical body, and in fact, courses that allow you to become a qualified practitioner in practice, have a part of it where you have to acquire face-to-face supervised client hours. So I made a bit of a list here of the things that sometimes students fail to do. And the first one, Ken, is making sure you log the hours.
Yep.
And I know that sounds a very simple thing, but I've come to the end of courses and I've said to students, you logged your hours? Yeah, I got the end, not log my hours. I haven't got a log. Well, it has to be sent in. Well, I haven't got one. So that's the immediate problem.
Yeah,
and
I think, Rory, just on that, because that's a really important one. When you're logging your hours, there is a specific form that you should have access to be able to log them. So popping it in your diary, and this is, again, with you saying that you'll say to a student, Rory, back in the days of tutoring, have you done your hours? And they go, oh, yeah, no, that's all logged. It's written in my diary, the dates I did the appointments. No, it's got to be filled out on a specific form. And it's a really good idea to do it as soon after the session as you possibly can. If just finished with a session with a client, log those hours then, and then you're going to, of course, log the supervision of those hours. And I just wanted to put in a bit of a I don't know if it's a caveat, a disclaimer, I don't know what this is. In the beginning, we said, we've seen portfolios returned because of these client hours. It's not because the students didn't do the client hours. It's not even because the students didn't have the client hours supervised. It was just that they weren't filled in correctly, and that wasn't made clear. So that's why we say when you're logging those hours, make sure you use the correct forms for your course. If you don't understand it, go and ask your tutor and say, is this right? I've just logged my first client hour. Is this how it's supposed to be? And just get an approval on that, or speak to a peer.
Absolutely. And also find out how many hours you need.
Yes.
Because some will be 100, some courses may be more. So you need to, right from the get-go, you need to find out how many hours. And, one of the things is to make sure that you're not adding hours that are not counselling related. I had one student who brought a sheet in, and we had 15 minutes here and 20 minutes there, and it was a bit of a dog's dinner, and I said, they have to be whole hours or 50-minute hours, and it's like, and it wasn't someone I taught. It was when I first took over the provision, when I first started teaching, and either she hadn't realised or she hadn't been told. I think probably she hadn't realised, and I think about 50% of her hours were just not submittable because they were a 15-minute assessment, or they were half an hour, or they weren't full counselling hours. Now, I understand that sometimes you see a client and they may just decide to go. I think you need to speak to your supervisor. If you've got a client who comes and for some reason they have to go after half an hour, you need to speak to your tutor and say, what do I do about this? And your tutor will guide you. The other thing, Ken, that trips students up at the finish line is that every hour has to be supervised. And what happens is, as students come to the end of their 2 years, and it's a long haul, it's the hard miles. Counselling training is hard miles. They want to finish, and what's sometimes happening in that tunnel vision is that they forget that every hour needs to be supervised. So you get to 98 hours, and you think, I'm nearly there. So you have 2 hours that you've done. Your log is 100 hours. That's it. I've done. I've completed it. Not until those 2 hours are supervised.
Yep.
Those have to be supervised. They're supervised hours. So make sure that every single hour that you put on that form is supervised. And while I'm talking about that, in the correct ratios, a lot of awarding bodies will talk about 1 calendar month. You've got to have supervision within 1 calendar month. So make sure that your supervision ratios are correct. All this should be covered in college, but I think it's just worth reinforcing that, Ken.
Yeah, it's important to look to your ethical body. As a student out on placement, you're going to be a student member of an ethical body. What are the requirements for your course? Look at your training provider. What are they recommending are the requirements, because it differs from course to course. So make sure that you're working to your course and your awarding body or your university's requirements on you. Use the correct form, as we've already said. Make sure that everything has been supervised, and it will be evidence that it is supervised. On the form, there will be a place where your supervisor will sign to say that these hours have been supervised. And then also remember that the agency in which you do your placement also have to sign to say, yes, you've done these hours. So there's a lot to remember there, a lot of moving parts. And that is a way of evidencing that those hours truly were done. Because at the end of the day, it's been looked at by an external assessor who's never met you before. So they just need to have that reassurance that these hours were done. And when you're looking at your hours, we see so many questions around required hours and how much supervision do I need for these hours? And what happens if I only saw one client? Do I still need to go to supervision? All of these are answerable by your college and your course or your university. Speak to your supervisor, ask them as well. They should be guiding you through this process of submitting your hours. And then also look to the ratio of how your hours are done. So as we speak at the moment, there are on some courses with some ethical bodies and with some training providers, there is provision for doing hours online, where you don't have to, where you're not face to face in a room with the client. You may be meeting them over online or via telephone. There is a ratio of how many hours you can do online and how many hours are required in a face-to-face setting. And it's worth just knowing what they are, get a full understanding of what is required from you, so that kind of as you fill that in and put and submit those hours, it doesn't come back to you. And of course, if it does come back to you, it's not the end of the world, is it, Rory? If you do get it coming back to you, and we've seen it before, you know, there's almost a feeling of dread. If I put my final portfolio in and it boomerangs back to me, all they're saying is, hey, we're missing some information here. Just help us out by filling it in. But it can cause stress, and we want to help you not have to face that stress by preparing first.
Absolutely. And another couple of things, really. If you are working with two agencies, then you might want to find out how your awarding body wants the hours. So some awarding bodies will want them sequentially. So it doesn't matter which organisation you're working for, you put the hours in from 1 to 100 in the date. So, you know, I saw one client at one agency on the first, and I saw another client at an agency on the second, and you work your way down until the whole form starts at 1 and ends up in 100. And of course, both those need to be signed off by each agency. And there's one little, I guess oddity is the word, with some awarding bodies, and again, check with your tutor. If you're working with children, at least one awarding body I know says that 30 minutes can be counted as an hour. And the reason for that is because children's attention spans and their ability to kind of absorb the emotional side of things are a lot lower, can be a lot lower than adults. So they will sometimes accept half of the hours if you're working with children at 30 minutes, but you probably need a different form and you probably need a different disclaimer. So again, it's going back to your training provider and making sure it's really, really clear. And finally, logging, you know, it might seem a bit of a fuss to log these hours, but actually, if you decide to go for accreditation, you know, you can actually, I think, take the hours that you've done as a student and add them into your professional hours for the 450 hours you need for accreditation. So it's good practice to have a log.
Yeah, that's a very good point, Rory. And many practitioners go on to continue to log their hours way into the thousands for the rest of their career. They might just log their hours. It's very good practice once you're in it. It's an interesting navigation, isn't it, with the hours? And I think if there's any message that is taken from this, it is go back and ask your tutor, check with, if your qualification is through an awarding body, check with the awarding body. They will always have a website. So if it's CPCAB, you'd go to CPCAB website. They're going to have the information outward facing and there and easy to find. Be sure. And I mean, there's additional complexities. One complexity that I'm thinking of at the moment, and we're not here to give you the answers, but it's to kind of flag these so you can ask them. One of the complexities is we spoke recently in a recent podcast, Rory, that it's not unusual these days to have more than one supervisor. However, there may be a requirement on your course that all of your hours are supervised by the same supervisor. Now, what happens then if you have a need to change your supervisor halfway through your training? What happens if you do need two supervisors because maybe you're working with one supervisor who is supervisors in your core modality, and then you might be using another supervisor because they specialize in online working and maybe the first supervisor doesn't have that skill set. It's all complexities that need to be clarified first. As soon as you get the answer, you know what is expected of you, then you know what to fill in, and then you don't have to have that feeling of that being returned to you.
Yeah, absolutely. And I think that's quite pertinent for some agencies that insist that you have supervision with them. And I've come across many students through the years who've said, I'm not actually getting what I need from the supervisor from the agency. So they've taken on a secondary supervisor that they see that kind of gives them more of what they need. And I guess the question is, who signs off the supervision hours? Is it the external supervisor or is it the internal one? I think that is a question.
Yeah.
That is a question for your for your tutor. But if you get all your ducks in a row, you submit your supervision form and you should be fine. But just make sure, certainly with those supervised hours, as you come to the end of the course, you're getting near to the end, you've got 2 hours, you have them in, that's it, I've done, fantastic, I'll hand that in, that's one big tick done. Make sure they're supervised, because I've seen so many students just fall at the last hurdle because they've not had those 2 final hours supervised.
Great topic for our student services today, Rory. So thank you for joining us. We're grateful that you lend us your ears. This is the Counselling Tutor Podcast, episode 292.
Yes, we started off with ethical, sustainable practice, and we discussed ethical frameworks in supervision, the importance of weaving in the ethical frameworks or codes of practice into your supervision activity and indeed your everyday thinking when you're working with clients. Practice Matters saw me speaking with Kate Day, a professional who knows so much about working with self-harm, and she shared valuable insights. And then finally, we landed on student services, logging client hours, the do's and the don'ts. We hope that we've helped you not trip at the finishing line. And before we close out today's episode, got a favour for you, the listener. If you've enjoyed and benefited from our conversation today, please leave us a 5-star review on whatever platform you're tuning in from. It genuinely helps us reach more ears and grow our community. And secondly, if you know someone who might benefit from hearing the podcast, why don't you pass it on through your social media so they can hear it too. Your word of mouth is so powerful. We appreciate every share, tweet or X as it is now, or post that brings listeners into our community. Thank you so much for allowing us to be part of your journey. And as always, stay grounded and stay safe.
Take the stress out of your counselling studies and get the support of Rory and I by joining us in the Counselling Study Resource. See how Counselling Study Resource can help you. Visit counsellingtutor.com. That's counsellingtutor.com.
Thank you for listening to the Counselling Tutor Podcast. Find the show notes for this episode by visiting counsellingtutor.com.